Hello Africa, welcome to HealthAfrik, your favorite health show on AAU TV. AAU TV is the voice of higher education in Africa, and it is brought to you by the Association of African Universities. My name is Isabella Ahinakwa. Today on HealthAfrik, we'll be talking about first aid. Yes, despite the various precautions and care taken each and every day, incidents are bound to happen. And the question is, in any case you found yourself in an emergency situation, would you be prepared or ready to assist yourself or others? What do you really know about first aid? Is it simply getting a box full of several medications? Well, I have here with me Madam Carol Calevo. She's the head of emergency department at St. John Ambulance, Ghana. She's also a professional nurse with a lot of years experience in her field. Also, she's a professional teacher who mostly teaches on health-related topics. She's here to educate us on everything concerning first aid. We are going to take a break, and when we come back, we'll start with the discussion. Please stay tuned. You're welcome back from the break. This is still HealthAfrik, your favorite health show on AAU TV. And as I mentioned earlier, today we'll be talking about first aid. With me here is Madam Carol Calevo. She's here to educate us on first aid. And as I said, she's from St. John Ambulance, Ghana. St. John Ambulance, Ghana is an institution that was established in Ghana here in 1937. So this year, they'll be celebrating their 84th anniversary. I am happy about it because they've got a lot more to educate us, so be expecting more from them. You can follow this discussion on our social media platforms at Association of African Universities on Facebook and YouTube, and our dedicated website at tv.aau.org. Hello, Madam Carol.
Hello.
You're welcome to HealthAfrik.
Thank you. I'm so happy to be here.
Same here. We appreciate you accepting our invitation when we called. Okay. So before we start with the discussion, we'll first get to know more about you and then your institution.
Yeah. My name, as you said already, is Carol Calevo.
Okay.
And I work with St. John Ambulance.
Okay.
You've said everything about me. I'm a nurse and I'm a teacher. And my passion for this work has made me to be here. Immediately you called me, you know, I quickly gathered everything and I came here. I'm mostly glad to do this because a lot of people, you know, during accidents or emergencies, even though in Ghana here, they have the passion to help people, but the problem is that they don't do it properly. And so by the time they get to the hospital, the people would have died some unnecessary deaths. So it's important for us all to know something about first aid and to want to do it so that we will make sure that we save our country for productivity.
Thank you very much for coming. Now, to get started, we would like to know what actually first aid is. You know, some people, when they hear first aid, what comes in mind is a box with paracetamol, bandage, and others. But then they don't really know what first aid actually is. So would you tell us what it is?
Thank you very much. First aid, as the name implies, first and aid. So first aid is simply the first person who meets an incident and want to help. Like you meet an incident, like an accident on the road or fire or anything, and you want to help. First, you pause and ask yourself. That is the question most of us don't ask before we jump in to want to help. But then first aid is the immediate help that you want to give to someone who has suddenly taken ill or injury or has had an injury or burns or anything. And then we all know that this thing happens suddenly. And so you don't plan to have an emergency. So when it happens, I want to help you. But how do I do it? So I will urge that it's very important that we all know what first aid is.
Actually is.
And then what I'm saying is that first aid is just the help that you give to somebody who has suddenly taken ill or has had an injury of any kind.
So if first aid is the first steps or helping someone who is in an emergency, then
injured.
Okay. Then what are some of the principles? Because everything has its principles. So what are the principles of first aid?
Okay. So good. The principles or aims of first aid is that before everybody does something, like you said, you have to have a plan or you have to have a reason why you are doing that. Our main reason for wanting to do first aid should be that you want to prevent the condition from occurring. And then secondly, you want to protect the incident from occurring. And then if it has already occurred before you got there, then you want to promote recovery.
Okay.
So these are the main principles. But then we want to say that if you do that, then what will you be doing? You want to give treatment to the person. By giving the treatments, then you need some skill to be able to do that.
Exactly.
So it is very important, and everybody also, I'm hammering on this because it's the most important that if you know what to do, you will save lives appropriately. So the three main reasons why we will do first aid is to prevent the condition from getting worse when you meet it. When you meet some people meet accidents. The leg is broken, the head is bleeding or something. They just started carrying the people. For instance, quite recently, something happened in Kintampo, and then they were just carrying the people in vans and taking them to wherever. What about if the person is just bleeding and you put some people on top of me? By the time I get there,
gone.
Exactly. So I would have prevented it by selecting or sorting out those who are in various injuries. Then I will know that I'll put these people in this. But we put all of them because we don't know. So most of the time we want to give treatment, but you have to know what kind of treatment you have to give before you get to help the person.
So if I get you right, the principle is to plan, prevent, and then promote.
Yes.
All right, okay. Now,
and then you promote recovery of the person. Promoting recovery is when you have to reassure the person and let them know what you are doing. Because if I meet you in the street, then I have to meet the doctor or the nurse in the hospital. But if I meet you in the street, it means you are just anybody.
Exactly.
So let me know that you have the skill to help me. Then I will relax. Okay. So.
Okay. Let's say I go to meet someone who is in an emergency situation. Should I just jump to the person and then start rendering first aid, or there are certain things I need to take and there are certain steps I need to take before rendering my first aid service to the person?
Most importantly, it will be very good if you would also look at yourself as a need, because if you get hurt, you cannot continue to help me. So before you go to do that, then you will have to collect some data. You have to get some information about what kind of incident is it, what has caused the thing, so that in case I go, let's say maybe there's spillage. There's a spillage of certain poisonous gas, and that is what I have inhaled. And so when you came there, yes, you have the passion to help me, but then I think it will be very good if you assess this, or you take a survey. You assess the situation before, you know what kind of incident it is, so that you collect some data and then see it's very important there should be a hazard, and you look at the risk around the hazard. So you look at what kind of hazard is it, and then what are the risks that are accompanied with it. Then you'll be able to help me. It's very important that you take the risk and the hazard condition into consideration before, and then yourself as well. So you take into consideration yourself, the scene or the people who are around the place, and then the casualty. The casualty is the person who has had the incident. So these three things, you have to note them before you jump into helping somebody.
So, Auntie Carol, is first aid very, very important?
You said very, very. Why did you say very, very?
Is it very important? Is it important?
Very, 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 very important.
So what are the reasons behind it?
Yes,
what are the importance?
It's important. Like just as we have discussed, we have said that if, for instance, I'm at work and then I left my kids at home, and then something happens, and then the other children or the members of the family or the members of the house, some of them know first aid. They will not call me from the office to come and then say to leave the office work and come to the house. By the time I come, they would have saved the situation, my money and then my time. They will save it. And then it's also very important because it brings the health team and then the public to collaborate and save lives. Because if a first aider knows that immediately after securing the person's life, I have to take the person to the professionals. So then there's the kind of liaison collaboration between the health team and then the public. And then it also makes you confident. It brings some
confidence. Is it the first aider?
Yeah, the first aider, and everybody will immediately if you learn first aid and you know what to do when there's an incident, it gives you some kind of confidence. You can approach situations with some confidence in you.
It's like you're a hero.
You become not a hero, but then you have this kind of confidence in you because so many people don't want to see blood. The scene of blood is very scary. And so people don't want to go to a scene. But if you learn first aid and you know all the skills about it, when somebody gets injury, you move forward, bare-chested, and you go and save a life. And you become very proud of yourself that you have saved somebody's life. And then you have used the appropriate techniques to save a life. So some of these things will make first aid a very important course for everybody to learn to do.
There are various types of first aid, I know, different types, and then each have its own approach to attend to. Can you mention some of these types and then slightly or briefly tell us the first steps to involve in it?
Yeah. For us in St. John Ambulance, we have meticulously studied our society, that is Ghana. And so because that is our core mandate, we train, we talk to people, we educate. So we have looked at the various institutions, various groups of people, and the kind of first aid that they need. So instead of maybe you would have known or read somewhere that we have levels in first aid. We have level 1, and level 2 or level 3, okay? But then for us in St. John Ambulance, because we want to cover the whole country, we make sure we have something when it comes to first aid for every group of people. So for instance, we have first aid for people like industrial, like people who do construction work and the rest. So those people will need a bit more higher skills in preventing injuries and all that. So we have those type of first aid. And then we have some for schools as well, because if we are able to train our children or give them skill in first aid, they will be able to cater for themselves when we are not there. So we have first aid for kids as well. And then we have also looked at the airlines, we have looked at the mines, we have looked at construction and the rest. So we have captioned it such that we don't have just one or two, but have varieties that are meticulously selected to cater for every category of individuals within the society. So I think that's what I'll say.
All right, we'll go for a quick break, and then when we come back, we'll continue with the discussion.
You're welcome.
Well, you heard it all, but then we've got more to tell you. So please stay tuned as we go for the break, and then when we come back, we'll continue. You're welcome back from the break. This is still HealthAfrik on AAU TV, and before we went for the break, we got to know the various types of first aid, and then we got to know slightly approach to it. We are going to continue with the discussion, and if you just tune in, you can follow the discussion on our social media platforms as Association of African Universities on Facebook and YouTube, and our dedicated website at tv.aau.org. Auntie Carol.
Yes.
Now, I would like to know the limitations involved in first aid. If somebody is trying to render a first aid service to somebody, are there limitations to it?
Of course, yes. There should be a lot of limitations. Limitations for those who don't know first aid and they want to help. Sometimes what happens is that they rather harm the people than rather alleviating their pain and suffering. So we say that they get some limit because in skill they are limited. So it is very important. I still hammering that it's important that wherever you are, ensure that you come to St. John Ambulance and learn first aid.
Exactly.
So some of the limitations are that if you don't know what to do, you will do the otherwise and you will harm the people. And then it will go against the law of first aid. Another limitation that I want to talk about is a cultural background where first aid is such that you touch people, you try, you know, you go closer to the person and help the person. But let me beg to use this word. Our Muslim brothers and sisters, they have their own cultural laws and the rest. For instance, I meet a casualty, I meet somebody who is fitting or had an epilepsy, and then I wanted to go closer. Maybe it's a male and I'm a female, especially when the person is a female. Males are not supposed to be touching Muslim females anyhow. So it becomes very, very difficult when a first aider gets to have an incident of that nature. Most of the time there is a solution such that if where you are there is somebody there who is the opposite sex, then I think you ask the person to help you. Because at all costs you don't have to leave the person to die or hurt her. So you teach some other person, maybe a female, to other than that, most of the time they don't allow it. If you are unconscious, you are not dead, you still can hear me. Okay, so they have been, there's so much fear in them that if my husband sees another man touching me, this, so they will not give you the chance to really touch them. And then if you are not careful and you leave them, you will be flouting the laws of first aid. And so you have to help by either calling somebody else or by getting someone else who is around and is the same sex to help them to save it. Your aim is to save life and not to abide by the cultural laws. So to mention by just a few, these are some of the, and then most of the time, there's one more that I think, most of the time, you know, we give mouth-to-mouth resuscitation. Okay, and in this time of COVID, you know, we are social distancing. So it has become a very, very difficult problem for us to really render a very requisite or good service to the public because we are social distancing. And so, yes, St. John, because we are the professionals, we have been able to caption, we have been able to have a program such that in this COVID time, we still have a very very good professional way of giving first aid to the people to save their lives in this pandemic. So I think this is what I have to say when it comes to limitations that first aiders have in giving their service.
Let's say I go to meet someone who is in an emergency situation and then I rendered my service as a first aider. I'm not qualified to be a first aider, but I can do something. And then unfortunately the person passed away. Would I be sued for that?
Of course, yes.
I would be sued.
Of course, yes. I think even in our communities, you know, if I come to meet you with someone and then I don't know what happened, I don't know what you guys were doing, and then you mentioned that the person is dead. Do you think I have to leave you just like that? No, I will not. I will seriously not leave you. So it means that you'll be sued.
Oh, okay.
If you will not be sued by the law courts, you'll be sued by the society in which you live in. Do you see? So it is also very important that everybody must learn to do first aid. You understand? In the past, or in some time back, our people were doing first aid.
Okay.
They even, when you have burns, they put water, or some of them put shea butter, you know, salt water, and they pour it on it for you. They just want to help you. But is that the right thing to do?
Yeah.
Yes, it is not. As we come, I mean, when we finished it, I think all of you should come. Those of you who don't know first aid, those of you who have put salt, saline to people's wounds, we all come to St. John Ambulance and we give you the techniques.
Some even put perfumes on the wounds.
So all this is not allowed, but we do them. So in giving first aid, we say that for first aid, our sole aim is to alleviate what? Pain and suffering. It's our core mandate that we alleviate pain and suffering. For that matter, if in doing that, by using the crude method to do that and something happens, you will be sued for it. Okay. So it is very important that if you don't want to be sued or if you don't want to have any problem, then come and learn it. And then you have to learn it and be certified. I'm a nurse. Okay, so if in my line of action something happens to me, we have to go through the processes that I used to help the person before it happens. I'm certificated. Okay, so I can go ahead confidently. These are some of the the things, the reason why you should do first aid, because you have confidence, you know you can do it. So you approach it with that confidence and do it. So if you don't know first aid, you must be very careful when you want to render first aid services.
All right. So
I want to take the opportunity and say this. Some people, they go to books and then they go and read online, and then they think that they know first aid. I'm telling you, you cannot go and learn it just like that, or read around it and think that you know it. So I'll urge everyone to come to St. John Ambulance specifically and come and train and then acquire first aid knowledge.
Now, saying everyone should come, the question is, can anyone be a first aider?
No. Unless you are trained, like I said, and you have been certified. St. John Ambulance, even in the training, we then just don't train you, and then because by virtue of training you, you acquire certificate. After training you, we will assess you meticulously. And then after the assessment, if you are able to meet the criteria, before we can render our certificates for you, because we don't want you to go and do what you want, but you do the right things to save life.
Now, before I come to you for training, do I need some specific requirements?
Anybody. Just
Okay.
anybody at all can come and train as a first aider.
All right. Now
and we also need, you can also come and volunteer.
Oh, okay.
Yes, like a TV presenter, blah, blah, blah. You can come. You are a doctor, you are a nurse, you are a businessman, you are a lawyer, everybody. You are an elderly, you are accountant. You can come to St. John Ambulance, walk in and come and volunteer. Tell us that when there is a problem, we can call on. If we need money, St. John Ambulance can call on you, and then you come and help us. So we have the volunteer wing, where anybody at all
can come and help
in the walk of life can come there and volunteer to support St. John Ambulance.
Okay. Now let's come to the common thing we know when we talk about first aid, which is the box, the first aid box. What are some of the list of medication that needs to be in that box?
First aid box.
First aid box, I mean, yeah.
We said first aid is a skill. And then somebody, it's only two things. Somebody will have to be injured, or the person is ill. Okay. And then with that in mind, that one to have been meticulously selected and then put together. So for first aid box, we have different types of first aid box. In St. John Ambulance, like you said, first aid box may contain, for me, is gentian violet, plaster, bandage, and mercuricum. For a first aid box in St. John Ambulance, that one too, we have sat down thinking about the public.
Okay.
So we have put them into sizes, and the size depicts the group of people that will use it.
Okay.
For instance, we have the small size. For the small size, we want, it's just captioned such that only from 1 to 3 people. For instance, let's say that the saloon car, like for a car, you know, you can put it in your car, so that in case you are traveling and something happens, you could use that. And the content in that one will not be the content that will be in the first aid box that is in the trotro and the rest. Okay, so for that one, we have mainly the PPEs, that the main first PPE, especially in these COVID times, you have the face mask, you have the gloves, you have some bandages, and you have some gauze pads. And then, in cases where there might be burns, we have some burns gels. And then we have scissors for cutting, we have blades, we have antiseptic that you can use, or soaps that you can use in case there is bruise or something, so that you wash it and then you clean and then you bandage it nicely. And then secondly, we also have the medium size. The medium size is mainly for people like in the offices, maybe group of people like your office here, you have the medium size. The content may vary because what kind of injuries or sicknesses do happen around. So we look at the injuries that will happen, and then we package the first aid board accordingly. For the medium ones, we give it to offices, corporate organizations, and the rest. And then we have the large one, or the industrial one, which is also made specially for big industries or for construction work sites, like the mines, like building sites projects and the rest, because you know, for that places people climb and then they might fall, they might have head injuries, they might have maybe fractures and the rest. So we have splints in there, we have plasters, we have triangular bandages, we have burns gel, and a whole lot. Seriously speaking, if you want the best first aid box, come to St. John Ambulance. We have them in various sizes and for various purposes. Come to us, and then you will have the best, the standard. Thank you.
Now, before we come to the end of today's discussion, do you have any last word? Maybe I didn't mention something that you would like to talk about. Maybe some recommendations to our viewers.
Thank you very much.
You're welcome.
Like I began to say, I wish I have the power to make everybody the first aider by the end of the year in this country. So the number one thing I will say is that every dying human being in this country, if possible, should try and know something about, and acquire skill, and a certain skill in first aid, and it will help us, so that we all know the times that we are in is very bad. And in these COVID times, when we are supposed to be social distancing, then if you know you have a certain skill in first aid, you can help yourselves whilst you are in homes, whilst you are in the offices, or whilst we are in the construction work sites. Secondly, St. John Ambulance is 84 years old. Oh, hooray.
Hooray.
So we are going to be celebrating it in June. And so we'll be coming up with a lot of interesting programs to educate the public on what to do when they get into certain emergency situations. We'll come back. And then my call is that some people, the other day I met some drivers, they are like, Madam, they said you people have first aid box. And I was like, what is first aid box? He says, we don't know. They said GPRTU said we should get it. Other than that, police. So this is the reason why you are getting it. So it means that when something happens and this taxi driver is in there, he will not touch it. He just use it to put there, showcasing it, and then you will not do anything because he doesn't have a skill in it. So please, everybody who is listening to me, make sure you come to St. John Ambulance, get a first aid box, and we will train you how to use, because we have everything in there. And then we'll teach you how to use the items inside the first aid box so that you can help us to save life.
Thank you very much, Auntie Carol. Thank you very much. We really appreciate you coming here. This brings us to the end of today's discussion, and we talked about first aid. I believe you've got enough, to educate yourself on what first aid actually is. We've got more for you as they are celebrating their 84th anniversary. They've got more and more to educate you, so be expecting more from them. Well, if you just tune in, you can go back and then listen to the discussion on our social media platforms as Association of African Universities on Facebook and YouTube, and our dedicated website at tv.au.org. My name is Isabella Ahinakwa Tetteh. See you again next time.